Hello and welcome to our channel. In today's video we will discuss about a very deep acting and polycrest remedy, that is phosphorus. And we will also discuss about what are the 9 special centers of sphere of action of phosphorus on human body. And after that we will discuss about what are the mental generals of patient of phosphorus, and we have already made a very beautiful mnemonic for you guys to remember phosphorus for permanently in your mind. So let's start our today's video, that is a deep and a polycrest medicine, that is phosphorus. So phosphorus is one of our best proved and frequently used drugs, and beside this, it's a remedy of very definite characteristic symptoms. According to Dr. Hahnemann, by using phosphorus in homeopharmacy has proved the fact that potentized medicines are no longer subject to chemical laws. As we all know, phosphorus is pure crude form and is highly combustible if exposed to air, hence dangerous, but when the same is potentized, it becomes one of the leading healers. So, common name of phosphorus is phosphorus, and it was discovered by Dr. Christian Frederick Samuel Hahnemann, who is considered as the father of homeopathy. And it's basically it has sanguine temperament and possessing quick perceptions and very sensitive nature, and also having bilious irritable temperament, but sora being the basic soil here. So the basic miasm here is sora, and it has tubercular and hemorrhagic diathesis. First of all, we will talk about tubercular diathesis. So it means patient is susceptible to cold, great liability to catch cold, enlarged neck length, that is scrofula, flat chest, wrinkled, old-looking face with sunken eyes and pointed nose. Patient craves meat and potatoes. Family history may have tuberculosis. Now we will discuss about hemorrhagic diathesis. So, wounds bleed very much even if very small. Wounds that appear to have healed break open again. The character of the blood is bright red, watery and non-coagulable. Intermittent flow, ecchymosis with purpuric spots, acute hemorrhage rather than chronic, calls for this great remedy, that is phosphorus. Now as you can see here on the screen, we have provided a picture of different potencies like 30Ch, 200 series potentized medicines which are made from phosphorus. Now next, as you can see here on the screen, we have provided a very beautiful mnemonic for you guys for remembering phosphorus for permanently in your mind. I hope you guys will like this mnemonic and will remember this for permanently to remember phosphorus. So let's start. So you can see here phosphorus. So P stands for pain in chest and aggravation from pressure. H stands for hemorrhage frequently and profused. O stands for operation of breath. S stands for sneezing and coryza from putting hand in water. P stands for prostrations. H stands for hollow eyes surrounded by blue rings. O stands for old people with morning diarrhea. R stands for restlessness. U stands for unable to lie in left side. S stands for cylindrophysis, long, dry, hard, and sago-like particles. So this was all about the mnemonic. I hope you guys will like this mnemonic and remember this particular medicine, that is phosphorus, in your mind for permanently by using this beautiful mnemonic which we have made for you guys. So this was all about the mnemonic. Now next we will discuss about the mind of phosphorus patient, or you can say mental generals of phosphorus patient. So let's start. So the patient is very much apathetic and indifferent to friends and surrounding, as in case of phosphoric acid and China. Even to his own children's, like in case of sepia. Unwilling to talk, thinks slowly, moves sluggishly. He has weary of life, full of gloomy forebodings, just like Sorinum. Patient is quite intelligent but physically weak. There is great fear in darkness, fear of death when alone, suspect as if something was creeping out from every corner of the house. Patient is oversensitive to external impressions like light, noise, touch, odor, etc. And patient has insanity with an exaggerated ideas of one's own importance, just like in medicine platina. The patient wants to be magnetized. So this was all about the mental generals, the mind symptoms of patient of phosphorus. Now next we will discuss about a very basic topic of this video, that is, what are the 9 special centers of sphere of action of phosphorus on human body. Now one by one we will discuss about those centers. So let's start. So the first center of sphere of action of phosphorus is on gastrointestinal canal. Okay, that is, it includes stomach, intestine, liver, spleen, kidneys. So let us discuss about it. So phosphorus has a powerful action upon this tract. In its unaltered state, it is not a local irritant, but it doesn't set up gastroenteritis as a corrosive poison unless it becomes oxidized in the stomach and hypophosphorus acid is formed. A swelling and shedding of the epithelial cells of the mucous membrane, like that we have seen occasionally induced by arsenic poisoning, and like that which obtain in cholera. The same process goes on in the intestines and is accompanied there by diarrhea, as in the stomach by vomiting. This is its acute action, but when gradually ingested by rabbits, Dr. Wagner finds that it to set up an irritation of the intestinal, which is described by Dr. Tyler, that is, chronic poisoning by the drug, is accompanied by cardialgesia, frequent vomiting, sense of heat in the stomach, diarrhea, tenesmus, pain in the joints, marasmus, hectic fever, and disease of the stomach, under which the patient may slowly sink. As was first pointed by Dr. Virchow that there is universally a gastroadenitis, which causes the gastric mucous membrane to thicken, opaque, whitish, grayish, and yellowish white. Under the microscope, the epithelial cells appear swollen and filled with granules and oil globules also. and in very advanced degenerations, the cell completely breaks down. This gastroadenitis is not due to a local action of the phosphorus, but because it occurs when the poison is introduced through other channels than the mouth. The duodenum and the intestine suffers similar changes. The stools are at times normal in character and frequency, but there is generally diarrhea or constipation with flatulence. Later in attack, the passages are in most cases very light, clay-colored, or even whitish, and exceptionally, they are bloody and in some cases phosphorescent. So this is how phosphorus acts upon GIT. Now the next special center of sphere of action of phosphorus is on liver. So let's talk about it. So the liver is really the greatest special center of action for phosphorus. No remedy produces more profound alterations of its structure. The first 24 hours, the gastric symptoms predominate, and then always almost. There comes on a comparatively healthy condition which may last 2 or 3 days or even longer. Then the severe symptoms begin, usually with jaundice, which increases more or less rapidly until it reaches the highest degree of intensity. With this comes urticaria, which generally accompanies severe jaundice. Simultaneously with the icterus, there is more or less pain in the epigastrium, especially in the region of the liver. At this time, enlargement of the liver can usually be detected by palpation and percussions, and this organ continues to increase while the patient is under observations. Mild febrile disturbances are frequent, and vomiting, now more or less bloody, comes on again. Now what happened after postmortem appearances in liver? So let's talk about it. So the liver is as a rule enlarged and presents the appearance of one in a high degree of fatty degenerations. It is usually pale yellow but may be deep yellowish. The acini are plainly perceptible and large. The substance is brittle and fatty. Here and there, ecchymosis beneath the capsule or along the course of the blood vessels may be seen. So this is how phosphorus acts upon liver. Now the next special center of sphere of action of phosphorus is on kidneys. Yes, we are talking here about urinary system. So let's talk about it. So character of the urine. At first, there is no marked change in amount, density, and later it is diminished in amount during the last few days, even to the minimum between 3 or 4 ounces fibrinous casts. And with the appearance of jaundice, biliary pigments, and acids. Leucines and tyrosine are rarely found in it, but paralactic acid is often detected in large amount, especially in fatal cases. According to Dr. Riz, he found that the urea almost completely disappeared upon the approach of death, and in its stead there appeared, even in cases ending in recovery, a peculiar nitrogenous extractive malarial, which was, according to 3 authors, very similar to peptone. In experiments upon animals, this appearance of urea could not be produced. The kidneys are very much enlarged and fatty. So this is how phosphorus acts upon the kidneys, that is the urinary system, you can say. Now next special center of sphere of action of phosphorus is on heart, or you can say CVS, that is a cardiovascular system and circulation. So let's talk about it. So phosphorus produces the typical fatty heart and arteries. The microscopic examination of the muscles of the heart shows excessive fatty degeneration, and that they are full of a large quantity of fine brown granules. The muscular tissues of the heart is pale and evenly colored of a light grayish yellow, and in some cases it is striped or contain net-like traces formed by light baby lines upon a grayish-red ground. The cardiac tissues is brittle and appear fatty both to the touch and to the eyes. So this is how phosphorus acts upon cardiovascular system and you can say heart. Now the next special center of sphere of action of phosphorus is on blood. So let's talk about it. So the blood is often profoundly affected, becoming very dark, losing its color, losing its power of coagulation, and apparently suffering also in its corpuscular elements, for ecchymoses are almost universal and hematin crystals are occasionally found in the viscera. The white corpuscles were observed during life to be increased in number and the red to be diminished in size and altered in form. The ecchymoses occur in all parts of the body, but are apt to be especially pronounced in the mediastinum and serous membrane. According to Dr. Mayer he states that when very large doses of the poison have been taken, the blood and even the urine may be phosphorescent. So this is how phosphorus acts upon blood. Now next special center of sphere of action of the phosphorus is on cerebrospinal system. You can say brain. So let's talk about it. So through the vegetative nervous system, phosphorus has a very powerful action upon the cerebrospinal system. According to Dr. R. Hutchins, he says, before, however, we dwell upon the phenomenon that, let us speak of the stimulant properties of the phosphorus. The substance is one of those which enter into the normal composition of the body. It exists mainly in the nervous centers in the form of a peculiar compound with fatty matter which have been named protagon. Such as iron is united with hematin in the blood. It actually forms more than 1% of the lumen of the brain. The amount gradually increases from infancy to adult age and then again decreases in. Now next special center of sphere of action of the phosphorus is on the sexual organs of male and female. First of all, we will talk about the male sexual organs, that how it affect. What is the action of phosphorus on the male sexual organs? So let's talk about it. First, male. So phosphorus has a special and profound action upon the sexual organs of both the sexes. The sexual organs share in the general excitement caused by moderate doses of phosphorus, but they manifest its influence in so marked a manner as to evidence a special action of the drug upon them, or upon that part of the nervous center where they derive their energy. As we all know that phosphorus is an aphrodisiac. It has a remedy for the irritable weakness of the male sexual organs, which is left behind by excess in binary and by masturbation. Experience has over and over again confirmed the indication of theory in this matter. So this is how phosphorus acts upon the male sexual organs. Now we will talk about the female sexual organs. So large doses of phosphorus produces in many women a bloody pseudomenstrual discharge, and if taken during pregnancy, it almost invariably produces abortion, or you can say miscarriages. Menstruation is too early and too scanty. When sinuses have been left in the mammae after extensive suppuration followed by chronic mastitis, phosphorus has been found of great value. So this is how phosphorus is on bones. So let's talk about it. So phosphorus has a specific and most wonderful action upon the lower jaw and the teeth, producing complete necrosis of the part. This develops in from 6 months to many years after the Bergman has commenced the dangerous employment. Occasionally, the first symptoms are not observed until after the patient has ceased working with phosphorus. The disease occurs in the lower jaw most frequently and most severely, and in the upper jaw rarely, but in a milder form. Yet the most extensive necrosis of the upper jaw has been observed. So this is how phosphorus acts upon the bone. Now the next special center of sphere of action of the phosphorus is on lungs. So let's talk about it. So upon the respiratory organs, phosphorus has a special action. On the respiratory organs, phosphorus acts as a pure irritant. I would not lay too much stress on the bronchitis, emphysema, pneumonia, and pulmonary phthisis observed in Bergman and rabbits exposed to its fumes, as these may be local effects. So they are accompanied, however, with the weakness, emaciation, and hectic which characterize the gastrointestinal effect of the drug. Phosphorus occupies a high place in homeopathy, therapeutic of respiratory affections, and pneumonia is the disease in which it has won its spurs. First introduced by Dr. Vienna, his great success with it has led to its general use throughout the homeopathic body. So this is how phosphorus acts upon lungs. So this was all we have discussed about what are the 9 special centers of sphere of action of phosphorus on human body, what are the mental generals, what are the mind symptoms of the patient of phosphorus, and we have also discussed a very beautiful mnemonic which we have made for you guys for remembering phosphorus permanently in your mind, to make it easy for you to remember phosphorus. So that's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below, and don't forget to meditate and exercise daily at least for 1 hour. And yes, thanks for watching our video.